Hello YouTube, this is Ebony and this is PCOS discussion. Today we're going to talk about pregnancy and PCOS. Okay, most people that have PCOS, their main question is how do I get pregnant? Okay, I'm going to tell you how you can get pregnant and also how you can help maintain your pregnancy. This might not work for everyone, so this is my small disclaimer. Might not work for everyone, but it's just a few added things that you can maybe add to your regimen of how to achieve pregnancy with PCOS. If you've seen my other videos, it will tell you how to track your fertility, tell you how to track your basal body temperature, tell you what instruments you can use, also tell you what tests you may want to ask your doctor, and if you want to also see a reproductive endocrinologist. And there's also a video telling you about the different fertility drugs that are available to you. Some women do not need to do all of those things. There might be some simple things that you just need to do, like changing your diet, consistently taking metformin if you're on metformin or any other insulin stabilizing drug. If you're taking any fertility medication, you just may need to do one or two of those things, or you may need to do a combination of things. But I would start out small by taking prenatal vitamins. You don't have to wait until you're pregnant to take prenatal vitamins. You don't need a prescription to get a prenatal vitamin. You can go to your local, pharmacy, like maybe a Target or CVS or Rite Aid or Walgreens or Walmart. They have over-the-counter prenatal vitamins. You just want to make sure that it has all the things that you need. And if you are allergic to anything that is inside of the vitamins, you want to make sure that you do not select one like that. Okay? I will share with you another time which prenatal vitamins I take, and also do a video on vitamins and their importance for achieving pregnancy and maintaining pregnancy. Okay? So we'll talk about that another time. But as of for PCOS, it's very important that you take your medications that your doctor prescribes to you, that you take them as you should. And, you also want to make sure that you have a good diet, like low carb, not a lot of sugar. You want to make sure that you exercise. I know it's hard to exercise. It was hard for me to exercise, but what I found that if I did like 15 minutes every day, that's what I started with. I got on my elliptical machine. I did 15 minutes a day. Then I slowly worked myself up to every day. I did like about 30 minutes to 1 hour of walking. Not just a slow walk. If you want to start off with a slow walk, but I tried to do a walk where I could still breathe, but I was starting to break a little sweat because, my body wasn't used to it, and I wasn't trying to jog first off because I'm going into being, no activity to some activity. So you want to start out slow. You don't want to put your body into shock. We're not on The Biggest Loser. So what I just did walking for 1 hour. You may want to work it up to 1 hour in the morning and 1 hour in the evening, or 30 minutes in the morning, 30 minutes in the evening. But any type of activity is great when you have PCOS, because even the best Olympic athlete or dancer or gymnast or whatever, if you have PCOS, it's going to be hard for you to maintain your body weight or to lose weight. So just know that PCOS does make it difficult for people. So don't let anyone tell you different. Okay? But it's achievable. And there are some skinny sisters. So just because, someone may be slim and they have PCOS, the person who may have weight, sometimes it can be very hard to lose weight with PCOS. Okay, I would recommend a book called The X Syndrome, which goes into more detail about the PCOS. They give it that name, the X Syndrome, but it's really PCOS that they're talking about, and they'll tell you more about the link between obesity and PCOS. Okay, so that's the main thing I would say, is to make sure that you take your medications, make sure you eat right, make sure you exercise, get plenty of water, That will get your body ready for pregnancy with PCOS. Okay, you want to make sure that you go to your doctor's appointments if you need to have extras. I know sometimes the copay kills people, but see what you can do, what you can work out. You may want to start like a little fund for yourself, so that you are prepared for these tests that you'll have to take. Because with PCOS, achieving pregnancy can be financially bearing on a person. You have to do many testings, which your insurance may not cover, but you want to be prepared, because in the long run, it's worth it. It's worth it in the long run, if you do achieve pregnancy. Okay? Not everyone is going to get pregnant at the same time. So don't think, oh, this person I know, she had PCOS, she got pregnant in 2 weeks, 1 month, 2 months. It might not happen that way for you. You might be a person that it may happen sooner than the other people you know with PCOS. But you cannot put limits on yourself. So don't knock yourself if it doesn't happen right away. Be patient with yourself and your body. Be comfortable with you. Okay? Work at your pace. You know, but you have to put effort into it. Don't just give up because it's not happening fast for you. Put your effort into it. It's achievable. Okay? So, and just make sure that you're charting so you know that you're ovulating. If you want to take the ovulation predictor kits, take those as well. Or go to a doctor that will test you and who will look at your ovaries and tell you that you are definitely ovulating. Like, they look at you in the beginning when you're starting to have your matured follicles. And then once you've felt that you have ovulated by using either a predictor kit or by using the basal body temperature, go back to that doctor so that they can look at your ovary again to make sure that a follicle actually left your ovary. So, you know, those are things that you can do so that you know where you are. Okay? So, never base yourself on someone else. You can get ideas from other people like myself and others that are out there, but never base yourself on those people. Like saying, okay, they achieved it in 3 months and I'm going to achieve it in 3 months. It doesn't work like that. So just have realistic goals. Try to make yourself like your levels. Like I said, know your levels. Know all your hormone levels. And try to work on those first. And then maybe while you're doing that, you might just achieve pregnancy anyway. And it's good to be calm. Listen to relaxing music. Make sure you time things. Also, check out your cervical mucus, because being on many of the fertility meds, if you're on fertility meds, can alter your cervical fluid. So you may want to use something like Pre-Seed. Pre-Seed is a very good lubricant that is sperm friendly. It will help the sperm. It will, you know, neutralize the pH balance so that the sperm can survive and pass through the cervix. Know all these things. If you've had surgery on your cervix before, or any biopsies or anything like that, you may want to check with your doctor to have him look at your cervix to make sure it's functioning correctly, because you may need something like IUI, which is when they take the sperm from your spouse or your partner and they insert it directly through the cervix into the uterus. So it bypasses that. So you will not have to worry about if your fluid is friendly to the sperm, or if your cervix is functioning or not. And if the man has a low sperm count, that can also be a factor. Don't always think that it's just you. Don't just knock yourself down. Sometimes the men can also be the problem. It can add to the fertility issue. So have your partner also check to see if their sperm is, the motility, the morphology. The motility and morphology means that it's shaped correctly and that it's moving correctly. All right? So you want to make sure that it's doing those things as well. It's not always just the woman. It can be a combination of the man and the woman. All right? So, and don't beat up your partner if your partner has that problem. You know, we are all facing different issues with our health. So don't think that it's just because of him or just because of you. We're not here to play a blame game. We all take part. If the both of you really want to achieve pregnancy, then you both have to do your part. If your your partner needs to take medications, then get him on some medication. If he needs to take his vitamins, get him on his vitamins. But like I said, we're going to talk more about vitamins at another time. I'm going to do different vitamins and how they're, how they work for fertility and for PCOS and for pregnancy. Okay? So, in maintaining a pregnancy, make sure, like I said, take your medications. Now, some doctors will vary on what they think is important and what they think is not important. My doctor says that, the metformin is not necessary during pregnancy. But I found for me, taking it throughout pregnancy has really helped me. I've had a loss before. I had a couple of losses before where I didn't continue to take my metformin. So this time around, I continued. I didn't take the full dosage. I was taking 1,500 milligrams a day. And once I achieved pregnancy, once I got past, say about 16, 17 weeks, I went ahead and I started taking half of that. So I was taking 750 milligrams. That's the extended release. And that is what I maintained on. I also made sure to take my calcium, take my folic acid, take my prenatal vitamin. I also take a vitamin D supplement because, people tend to have a deficiency in vitamin D. And you would more so have a deficiency if you're pregnant. So I took that as well. And I find that really helped me. My energy level was still kind of low because I was on progesterone suppositories. Okay. I didn't maintain the suppositories past 14 weeks. I wish I could have, but I didn't because I had to get a cerclage. And we'll talk more about cerclages. But basically a cerclage is a stitch in the cervix to help prevent the baby from coming through the cervix or help prevent you from dilating. And I had that placed. And once you have that placed, nothing can enter your vaginal canal. Nothing can start rubbing up against. So I couldn't take the suppositories anymore. So I started taking the Prometrium just for a few weeks until I was moved on to the progesterone shot for the, continuation of the pregnancy. And I still am on the progesterone shots. And I will do a video about that because it's a great thing. I think most people need to know about it. Not everyone knows. So I'm going to talk about the progesterone shots as well. It's not like the regular progesterone. So we'll talk more about that on another video. But you want to make sure you drink lots of water. Keep on your vitamins. Also, watch how you eat. Just because you're pregnant doesn't mean, okay, now I can eat it whatever I want. You still have PCOS. And it has to do with hormones. And your hormones are flying all over the place already. You don't want to aggravate it. So you want to make sure you try to keep your hormones as stable as possible as you can possibly. Because during pregnancy, your hormones are all over the place anyway. But you want to make sure that you're doing your part. So drink your water. And I was bad with that. I found that eating ice, like loads and loads of bowls of ice, have helped me because I'm not a great fan of water. So the ice helped because it made me feel like I was having a treat, like I'm having an icy or something. It's a clear, tasteless icy, but it helps. I preferred having ice more than water. So having the ice helps. Make sure you have your fruits, your vegetables. Remember, you're supposed to have like 7 servings a day. So if you can get in like at least 2 vegetables during the day. Also try to get in like 5 fruits. Have a banana, have an apple, have a pear. Switch it up. Don't eat the same thing all the time. Go to the store, buy a few of each thing, and do that. Okay? So, that helps a lot. Get you some natural juices. Don't pile up too much on the juice because, you have PCOS. Be mindful of how much juice you're drinking. Find out what a serving size is. I usually don't go past a cup, but usually juice, you're supposed to have like half a cup. But how realistic is that? How many people have half a cup of juice? So, or if you're a person that's fine that you could put ice in your juice. If you have a half a cup and you put ice, like McDonald's and everyone else does, they save on the juice or the whatever thing they're giving you. And it actually fills up to the cup size. So you could psych yourself out thinking you're having a whole cup, but it's really half a cup. So you can try that. But all of these things I'm telling you, it's great to try. And walk a little bit. Just because you're pregnant doesn't mean you don't have to exercise. Continue walking. Walking is good for you and the baby. Get your oxygen flowing. Having a good amount of oxygen is great during pregnancy. The baby needs it to grow and you need it to breathe. So getting around walking, you don't have to do brisk walking like before, like where I told you you're breaking a sweat. If you can do it, then do it, but just walk where you feel comfortable breathing. That's what I would just say. Doing little strolls. I started doing little strolls around the market and Babies R Us, everywhere. But it helps. It gets you going. Try not to lift anything heavy. If you need help with something, you might not think it's heavy, but if you feel tension in your arm as you're trying to lift it, then that means your uterus is also tensing up when you go to pick it up. So don't lift anything. You may feel like Superwoman. Ask someone else to pick it up for you. Okay? So those are my tips that I can really give for pregnancy and PCOS. In the next video, we'll probably talk more about the vitamins, like I told you, to help prepare you for pregnancy and to help maintain pregnancy. So we'll talk about that next time. All right? Take care. Bye.